Have you ever pondered the significance of first aid in the event of amputations? It's a grim scenario to contemplate, but the knowledge of what to do in such a situation can literally mean the difference between life and death. So buckle up and get ready to learn about the vital steps to take in the event of an amputation. First things first, always prioritize safety. Ensure the scene is safe for both you and the injured person. If it's not, make attempts to either remove the danger or move the person out of harm's way, if possible. Next, call for professional medical help immediately. Dial your country's emergency number and provide detailed information about the situation. Remember, time is of the essence in such circumstances. Now it's time to control the bleeding. Use a clean cloth or bandage to apply direct pressure to the wound. If the bleeding doesn't stop, apply more bandages or cloth, but never remove the initial bandage, as this could dislodge blood clots that have started to form. In some situations, using a tourniquet may be necessary, but remember, this is a last resort and only to be used if direct pressure fails to stop the bleeding. The tourniquet should be placed 2 to 4 inches above the injury, between the wound and the heart. Be sure to note the time of application, as this is crucial information for medical professionals. While waiting for medical help, it is important to help the person stay calm. Reassure them and make them comfortable. If possible, try to elevate the wound above the level of the person's heart, but only do this if it doesn't cause pain or further injury. If the amputated part is available, rinse it gently with clean water, wrap it in a clean cloth and place it in a sealed plastic bag. Then place the bag in a container with ice water. Never put the amputated part directly on ice or try to reattach it yourself. Lastly, keep the person warm and monitor their condition. Look for signs of shock, such as pale, cold, and clammy skin, rapid pulse, or unconsciousness. If these signs are present, lay the person on their back, elevate the feet about 12 inches, and cover them with a blanket. To recap, the key points about first aid for amputations are ensuring safety, calling for professional medical help, controlling bleeding, and keeping the injured person as comfortable as possible. It's also crucial to handle the amputated part correctly and to monitor for signs of shock. This knowledge is not something you hope to use, but it's certainly something you should have. Because when it comes to first aid for amputations, knowing what to do can make a world of difference. So keep these tips in mind and stay prepared.